This is the Justice Fighter Podcast. With attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.
What's going on, guys? It's attorney Gerald Griggs, a Justice Fighter, and there's been a lot of discussion on social media about the coronavirus and the flu. And so we really need to be informed in real time of the differences and why this is so important that people are responding appropriately to the coronavirus. And so I was looking around the internet, making sure I had all my sources correct, and I decided, let me go to one of the preeminent sources of information on medicine in the world, and that's Johns Hopkins Medical Center. And so they had a nice piece that kind of broke down what the coronavirus is and its comparison to the flu, so we can compare directly apples to apples and not apples to oranges or whatever may be floating around in our imaginations. And so this was from Dr. Lisa Markowitz, who is a medical doctor and has a master's in public health. And she says the influenza, the flu, and COVID-19, the illnesses that cause the new coronavirus, are both infectious respiratory diseases. Although the symptoms of coronavirus or COVID-19 and the flu can be similar, the two illnesses are caused by two distinctly different viruses. The similarities: the symptoms, both cause fever, cough, body aches, fatigue, and sometimes vomiting and diarrhea, can be mild and severe and even fatal in rare cases on both symptoms, and can result in pneumonia. The transmissions, both are spread by person to person through droplets in the air from an infected person coughing, sneezing, or talking. A possible difference: COVID-19 may be spread through airborne route. Both are spread by an infected person for several days before their symptoms appear. The treatment: neither virus is treatable with antibiotics, which only work on bacterial infections. Both are treated by addressing the symptoms by reducing fever. Causing severe cases may require hospitalization and support through a mechanical ventilator. Prevention: both may be prevented by frequent and thorough hand washing, coughing into the crook of your elbow, staying at home when sick, and limiting contact with people who are infected. Social or physical distancing can limit the spread of COVID-19 in communities. The key differences between COVID-19 and the flu: the cause. COVID-19 is caused by one virus, the novel 2019 coronavirus, now called Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. The flu is caused by any of several different types and strands of influenza virus. The transmission: while both the flu and coronavirus may be transmitted in similar ways, there is a possible difference. COVID-19 may be spread through airborne route, meaning that tiny droplets remain in the air that could cause the disease in others even after the ill person is no longer near. Antiviral medications. Coronavirus: the antiviral medication and other therapies are currently being tested to see if they can address the symptoms, but there is no cure. The flu: antiviral medications can address symptoms and sometimes shorten the duration of the illness. The vaccine. COVID-19: no vaccine is available at this time, though there are many in progress and in trials. Vaccine. Flu: a vaccine is available and effective to some of the most dangerous types or to reduce the severity of the flu. Infections. COVID-19 approximately has infected 2 million cases worldwide, 609,685 cases in the United States as of April the 15th, 2020. The flu: there's an estimated 1 billion cases worldwide, 9.3 million to 45 million cases in the U.S. every year. Deaths. Coronavirus: approximately 127,601 deaths have been reported worldwide. Approximately 127,601 deaths reported worldwide. 26,509 deaths in the U.S. as of April the 15th, 2020. The flu: 291,000 to 646,000 deaths worldwide. 12,000 to 61,000 deaths in the United States per year. The COVID virus situation is changing rapidly. Since the disease is caused by a new virus, people do not have immunity to it. The vaccine may be months away, and doctors and scientists are working on an estimated mortality rate of the COVID virus, but at the present, it is higher. It is thought to be higher than most strands of the flu. And that's the information coming directly from Johns Hopkins Medical Center, one of the preeminent sources of information in this country. So the next time you're having a nice debate or conversation about the coronavirus, please refer to the medical experts who are trained in this, who have dedicated their lives to the study of viruses and epidemiology, and don't depend on your imagination. This is Attorney Gerald Griggs. Thank you.
This is the Justice Fighter Podcast. With Attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let Attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.
What's going on, guys? Attorney Gerald Griggs, a Justice Fighter. And in the world of coronavirus, we've seen numerous responses by governments across the country and across the world. And I kind of wanted to talk a little bit about one of the most appropriate responses, and we can see it through the numbers of a small country who took this very seriously, and that's Taiwan. And so there's a report out of CNN on Taiwan and saying it's one of the best examples of how we appropriately respond to coronavirus. And hopefully many other countries will follow this lead. And so the story goes a little bit like this. On January 25th, as the world was still waking up to the potential dangers of the novel coronavirus spreading rapidly out of central China, two governments recorded 4 new infections within their territories. Australia and Taiwan have similar population sizes of about 24 million people. Both are islands, allowing strict controls over who comes in their borders, and both have strong trade and transportation links with mainland China. 10 weeks from that date, however, Australia had almost 5,000 confirmed cases and Taiwan had less than 400. The question on what was Australia did wrong: 20 countries have more cases than Australia, and 7 have 10 times as many. But now Taiwan has kept the virus under control when other parts of the world have not. And so the question is, how is Taiwan able to do this? And so the article dives a little bit deeper into what Taiwan actually did. So during the severe acute respiratory syndrome, which is SARS, outbreak in 2003, Taiwan was one of the most affected territories, along with Hong Kong and southern China, with more than 150,000 people quarantined on the island, which is about 110 miles from China's southwest coast. 181 died. While SARS now pales in comparison to the current coronavirus epidemic, it sent shockwaves through much of Asia and cast a long shadow over how people responded to future outbreaks. This helped many parts of the region react faster to the current coronavirus outbreak and to take more seriously than other parts of the world. Both a government and societal level, with border controls and wearing face masks quickly became routine as early as January in many of these areas. Taiwan has a world-class healthcare system with universal coverage. As news of the coronavirus began to emerge from Wuhan in the run-up to the Lunar New Year, officials at the Taiwan National Command Center, set up in wake of the SARS epidemic, moved quickly to respond to the potential threat, according to recent reports of the Journal of American Medical Association. Taiwan rapidly produced and implemented a list of over 124 action items in the past 5 weeks to protect public health. The co-author, Jason Wang, a Taiwanese doctor and associate professor of pediatrics at Stanford Medical Center, said in a statement, "The policies and actions go beyond border control because they recognize that wasn't enough. This was while other countries were still debating whether to take action. In a study conducted in January, Johns Hopkins University said Taiwan was one of the most at-risk outside areas of mainland China, owing its close proximity and ties and transportation links. Among the early decisions was a decision to ban travel from many parts of China, stop cruise ships from docking at the island's ports, and introduce strict punishments for anyone found breaching home quarantine orders. In addition, Taiwanese officials also moved to ramp up domestic face mask production to ensure local supplies, rolled out island-wide testing for coronavirus, including retesting of people who had previously had unexplained pneumonia, and announced new punishments for spreading misinformation about the virus. Given the continual spread of the COVID-19 around the world, understanding action items were implemented quickly in Taiwan, and the effectiveness of these items in preventing large-scale epidemic may be instructive for other countries, Wang and his co-authors said. The Taiwanese government learned from its 2003 SARS experience and established a public health response mechanism for rapidly enabling rapid actions for the next crisis. Well-trained and experienced team of officials were quick to recognize the crisis and activate emergency management structures to address the emerging outbreak. In particular, Taiwan's rapid and transparent response, with medical officials holding daily briefings on the matter, has been held up as an example of how democracies can still reign in epidemics, as some were claiming only an autocratic government like China could effectively control such a rapidly spreading virus. Taiwan has also avoided the type of strict lockdowns that characterize the response in China and many other countries. Taiwan is in such a strong position now that after weeks of banning the export of face masks to ensure domestic supply, the government said that it would donate 10 million masks to the United States, Italy, Spain, and 9 other European countries, as well as smaller nations who have diplomatic ties to the island. And so what can we learn from Taiwan? We can learn that when a government responds appropriately, stifles misinformation, listens to their public health officials, informs the public, and ramps up the appropriate products and preventive measures, they can have a on-time response to this global pandemic. And that was an article from about a week and a half ago from CNN on the Taiwanese response to the coronavirus. And as you look at the numbers in Taiwan, even today, you can still see that their response has limited the impact of the coronavirus in their country. And so let's kind of talk about their numbers as far as the world's numbers. Of course, today there are 2,026,051 coronavirus cases worldwide. There are 129,078 deaths, and 492,000 individuals have recovered. We're still going up the curve. The United States far and away leads the world with 615,000 cases and 26,000 deaths. And Taiwan currently has, well, let's talk about the cruise ship Diamond Princess. The cruise ship Diamond Princess has 712 cases and 12 deaths by itself. But let's look where Taiwan is. Taiwan currently has 395 cases, which is up 2 cases from yesterday, and 6 deaths. So even as we're still having this conversation, Taiwan's measures taken early during this process, not calling it a hoax, implementing the national production standards to produce face masks and social distancing and punishing misinformation and making sure people are abiding by quarantine standards, limited their cases. Well, the United States has, again, 615,000 cases and rising daily by about 2,009 cases each day. So we can learn from other places in the world about how we appropriately respond. Hopefully, this will be our SARS moment. You know, back when President Obama established the pandemic response team that was defunded and destroyed by President Trump, we thought we had learned. But now we have to learn in real time, and we have to be real and transparent with our elected leaders that there are examples around the world that you can look at and that you can glean ideas from, and that you don't have to rush into action with reopening the government when you don't have requisite trace testing, which Taiwanese have, and other measures like face masks being produced at a wide scale and not people having to make their own face masks. And all of these things that can help prevent the spread of the novel coronavirus. And so we have to be educated in real time about an appropriate response to this. And then we have to educate our elected officials, because it's clear that leadership is coming from the bottom on this issue, and that we have to continue to give the authority to the people who have the real authority, and that's the people. And then the people cede that authority to the public health professionals, that we can get the accurate information. So again, we're going to continue to bring you this information on Justice Fighter Podcast and on the Justice Media Network. Thank you for listening. Thank you for sharing. Thank you for subscribing. Thank you for spreading the information throughout the community. And thank you for being safe and abiding by the Centers for Disease Control's guidance on the novel coronavirus. I will continue to update you as the information becomes available to me. Please have a safe and productive day, and make sure you wear your face mask and wash your hands.
This is the Justice Fighter Podcast. With attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.
What's going on, y'all? It's attorney Gerald Griggs, the Justice Fighter. And thank you for subscribing to the Justice Fighter Podcast. And if this is your first time listening, please hit that like button. Please review us on all platforms, as we're going to bring you the important information in justice, social justice, civil rights, and politics, and all things that affect the pursuit of justice. So I'm attorney Gerald Griggs, the Justice Fighter. You can find us on all social platforms at Attorney Griggs and at the Justice Media Network. Please drop us a like, drop us a comment, make sure you subscribe, make sure you share the information, and make sure you stay safe. We're in a movement for justice, y'all, and it's gonna take all of us using these new platforms to get the message out. So again, it's attorney Gerald Griggs, the Justice Fighter. I love you guys. Stay safe.
This is the Justice Fighter Podcast. With attorney Gerald Griggs. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justice Fighter Podcast, y'all.